Hello everyone. Today I'm going to discuss about the important topic in the first aid and also surgical procedures, cardiopulmonary resuscitation. So this cardiopulmonary resuscitation. So in this topic, I'm going to discuss about the what is cardiopulmonary resuscitations, what are the histological events in the cardiopulmonary resuscitations, and also so what is the steps, what are the stages or phases in the CPR, and also what is the procedures, how we are going to perform the CPR, what are the special precautionary measures while giving the CPR, and also in case of how we are going to do in the supine lying positions, and also prone lying, the special conditions, how we are going to do in the prone lying positions, and in pregnancy conditions, how we are going to discuss what are the indications and contraindications of the cardiopulmonary resuscitations. So coming to the CPR, so what do they mean by CPR? So if you see here, the CPR standards is the C for the cardio, pulmonary, P for the pulmonary, and R for the resuscitation. So that means is a C for the cardio, that is C, and also P for the pulmonary. Pulmonary means lungs, and resuscitation means to bring back them into the normal function, to recovering them to the normal functions. So if you see the definition of the cardiopulmonary resuscitations, for easily understanding purpose, if anybody get any abnormality in their heart function and lung functions, and also we bring back them into the normal functions. So that means we until the normal like a treatment procedures such as any like a in case of the any ambulance or the medical teams comes until to the effect of the injury, or if anybody get the loss of consciousness or loss of heart functions, in those peoples we have to create artificially, so with our the manual techniques as well as the with the oxygenations. So especially if you see the definitions, the cardiopulmonary resuscitation is the technique of the basic life support. So who are having some difficulty in the heart function and also difficulty in breathings. So we have to provide the artificial ventilations. So the main purpose of this CPR is the purpose of is going to be oxygenation to the heart and lungs and brains until and unless the appropriate medical treatment can come and restore the normal cardiopulmonary functions. So before reach to that any ambulance or medical team comes to the patient, near to the patients, so who are available, so the any healthcare providers are normal people also. So then we have to give to facilitate the normal functions with through the basic life support such as the mouth to mouth respiration, that is artificial respirations, and also compression over the chest. So this is called as the cardiopulmonary resuscitations. So this is not a new technique. This is also not, and this is nowadays we are following what got the emergency in case of loss of consciousness and heart function and lung functions. So many people are who already trained, so they're applying the CPR, they're giving the CPR. But this is not a new technique. If you see the historical events about the CPR, so this history of the CPR, also cerebral arrest, prophylaxis begins in the ancient times. So it's started in the before the Christ also it started. So the first mouth to mouth ventilation started in the 3000 BC. So this is a very ancient times also started, and also according to the some statistics and also some research events. So it also recorded that in 1780s the first attempt of the newborn resuscitation by blowing. So it started in the newborn resuscitation in the 1780s, and also first experimental cardiac massage started in the 1874, and also in the 900s. So this 20th century started in the first successful direct cardiac massage in the men. So who are having some a collapse or maybe because of the heart attack and also heart strokes. So first cardiac massage, direct cardiac massage started in the 1901. So in the last 20th century it started. And also in the 1946, first experimental indirect cardiac massage and also defibrillation is started. So indirect cardiac massage is pressing over the chest, and also defibrillation with electrical equipments to give the electrical signals to the heart. So is electrical shock, nothing but for easily understanding. Defibrillation means electrical shock, or is the DC shock, the direct current shock to the heart. So it started in the 1946. So if you see the 1960, indirect cardiac massage started. So is the physicians already gave them in the 1960s. So he gave the direct, indirect cardiac massage who got some complication related to the heart function and also pulmonary functions. So, and also exactly the procedure cardiopulmonary resuscitation started in the 1980s by the doctor, the physician is the Peter Safar. He is the father of the CPR. So he first invented the CPR in the 1980s. So this first international CPR, that is the cardiopulmonary resuscitation guidelines, and is produced in the 2000. So in the by the uh, American Heart Association gives the so many like guidelines. So is going to give the, so depends upon the some time period. So these guidelines are going to give. So according to these guidelines, everybody has to follow. You have to follow the CPR rules and regulations. So Dr. Safar, the Peter Safar is the father of the resuscitation. So he developed the CPR. So and also is mainly is directly responsible for the research used in the therapeutic the hypothermia. In case of treating the therapeutic hypothermia, so he used this and also developed the CPR. So during he invented in the 1956, the Peter Safar and also James Hallam invented mouth-to-mouth resuscitation. In the 1956, United States of military adapted to mouth-to-mouth resuscitation. So methods to revive the unresponsive victims. So in the 1960s, so the CPR invented by the Peter Safar, Dr. Peter Safar. So he is the father of the CPR. So what is the cardiopulmonary resuscitation? So it's nothing but is the series of steps. So series of events are we are going to perform on the patient to establish the artificial ventilation and also circulation in patients with who is not breathing as a no pulse. So if anybody collapsed or if in case of any cardiac arrest or any stroke, so if the patient has any breathing difficulties and also if there is no proper pulse, so we have to start the cardiopulmonary resuscitations in case of as an emergency, like a resuscitations to bring back them to the normal function. So what is the purpose of the CPR? So the purpose is mainly is to restore the cardiopulmonary function, heart function as well as the lung function, heartbeat and also the breathing pattern, how to improve with the purpose of the CPR, and also to prevent the irreversible brain damage from anoxia. So because of the decreasing the blood circulations, or because of the collapse, heart attack also, so it may decreasing the blood circulation throughout the body. So it may use the cell death and also it may use the serious complications. So these purpose, so we have to do the CPR as soon as possible after patient get collapsed. So what are the indications of the cardiorespiratory, like a cardiopulmonary resuscitations? The first one is the cardiac arrest, respiratory arrest, and also combination of both. Sometimes it's going to get the cardiac as well as the respiratory problems are going to be arise. So in the both conditions, we have to do the CPR. So what is the cardiac arrest? So what is the definition of the cardiac arrest? Cardiac arrest means loss of the cardiac functions. So that means the heart rate and also pulse rate, and also loss of the breathing and also loss of consciousness. If anything combination of all these loss of functions, so it indicates it is called the cardiac arrest. And also, what are the causes of the cardiac arrest? So many reasons are there cardiac arrest. The major causative factors are so if you see here, the 6H, so 6H are the 1H is hypoxia, that means decreasing the decreasing the oxygen supplies to the tissues. Hypotension, that is a decrease the blood pressures. Hypothermia, decrease the temperature. Hypoglycemia, means decreasing the sugar levels. Acidosis, that is decreasing is increasing the hydrogen concentrations. And also hypokalemia, so that is nothing but is the decreasing the that's electrolyte imbalance. So especially is going to decreasing the potassium levels. So this may use the disturbance in the electrolyte disturbances. So these are the 6H factors are is the major causative factors for the cardiac arrest. And also the 4T. The 4T's means the cardiac tamponade. Cardiac tamponade is nothing but the surrounding structure of the cardiac tissue. That is nothing but sac surrounding to the heart. So especially the pericardium is going to filled with fluid or maybe any other liquid. So especially the surrounding to the heart regions. So in the pericardial sac. So this is called as the cardiac tamponade, especially is may chance to get the blood or any other fluid may accumulated surrounding to the heart. So that condition is called as cardiac tamponade. and also in the tension pneumothorax. So pneumothorax means is the accumulation of the air in the lungs. So if any lung accumulations, any trapped in the, like a trap of the air inside the lungs, so it is called as pneumothorax. And next condition is the thromboembolism. Thromboembolism means is the any blood clot. So because of the any blood clot inside the blood vessels, if you see in the blood vessels, the blood vessel has the three layers. So which is like a tunica intima, that is inner layer, tunica media, middle layer, tunica externa or adventitia, this is the outer layer. So if any blood accumulations are because of the any fat accumulation inside the blood vessels, so may chance to get the thrombus formations. So because of the thrombus formation, thrombus is nothing but the blood clot. So if any blood clot there in the blood vessels, so what happened? So because of the clot, so the other part of the blood vessel is not going to supply with the other blood circulation. So because of the clot, so it won't give the oxygen supplies to the other parts of the body. It may gives the like a tissue damage. So embolism means so the blood clot is damaged at one side of the blood vessels. So the blood clot is going to be ruptured. So the blood clot is the rounded materials or whatever the like a shaped material is traveled in the bloodstream. So in particular one place, this thrombus is going to be stuck. So because of the stuck of this thrombus, so is this traveling thrombus is called as the embolus. So if this embolus is also going to be the stuck the blood circulation to the other parts of the body. So this leads to the hypoxia and also tissue damage. And also another T, the last T is going to the one of the another important cost factor is especially for the toxicity. Toxicity is because of the any local anesthesias or any insecticides or any digoxin. So this digoxin also is going to be used in case of the like a diuretic. It's also is commonly used in the heart diseases. But if any like a toxic reactions, so may chance to get the cardiac arrest. So these are the causative factors for the cardiac arrest. So how to do the diagnosis of the cardiac arrest? So these are the cardiac arrest is going to be how to check for the time and also how much time within how much time. So they are going to get the blood pressure measurements. So the blood pressure is going to be how to measure. So how much the blood pressure is it the high blood pressure or low blood pressures? So if it is high blood pressure, we call it as the hypertension, or if it is low blood pressure, we call it the low blood pressure is called as the hypotension. So we have to check. So what is the causative factor for the cardiac arrest? So it's because of the high blood pressure or low blood pressures. And also how to take the pulse on the peripheral arteries, especially in the upper limbs, we have to check in the radial artery. Here we have to place feel the pulse. So is it pulse is present or not? So who are having a cardiac arrest, so because of the cardiac arrest, they may chance to get the loss of pulse. So especially we have to check in the upper limb in the wrist joint, at the radial pulse, and also we have to check for the pulse in the carotid artery. So here also this is the windpipe, just 2 centimeters away from here. So here we can feel the muscle, the lung is a muscle is from the clavicle, sternum and also clavicle, and also is going to insert into the mastoid process. So it's called as the sternocleidomastoid muscles. So between the windpipe and also sternocleidomastoid muscles, so we have to place the 2 fingers, have to palpate and also play and feel the carotid pulse. So in most probably, if any in case of the cardiac arrest, so these pulses may chance to get the absent. So that is the reasons we have to check the carotid pulse. So, and also if it's not pulse possible, we can check for the wrist joint, or maybe in the pulse, we can check the femoral pulse and the dorsalis pedis. So in the lower limb, upper limbs, and also neck, head and neck also, we have to check the pulse. Sometimes it may give the abnormality, maybe either in the upper limbs or lower limbs, or maybe in the carotid pulse. Coming to the auscultation of the cardiac tones. So we have to check for the auscultations. So we have to check the heart sounds. So what are the heart sounds are present or what are the heart sounds are absent. So in the last class, we discussed about what are the different types of the heart sounds. So, and also you can refer there so about the heart sounds. So, and also these are, we have to check for the diagnosis of the cardiac arrest. So we have to check for the loss of consciousness, a loss of apical or central pulsations, especially carotid and femoral. So we have to check the pulse in the carotid regions and femoral pulse, and also apnea. So there is a breathing, loss of the breathing. So these are the symptoms of the cardiac arrest. So if you have anybody having these 3 like a major signs, so we are going to confirm it having the cardiac arrest. So why we have to give the like a CPR? So how the CPR is going to be restore the normal functions or to prevent the serious complications. So how the CPR is going to work with to bring back them the normal functions. So the air we breathe in travel into the lungs. So where the oxygen is picked up by our blood and then pumped into the heart, the tissues and organs. So if you know the blood circulations, so how the blood is purified in the our lungs. So that means if you take the breath in, so whatever the breath in, the air enter into the lungs. So the lungs enter into the our windpipe. From the windpipe, it's going to the bronchioles. So from the bronchus, the major bronchus, and also the primary bronchus, secondary bronchus, and tertiary bronchus, and bronchioles. Then it's going to the enter into the alveoli. So where the gas exchange takes place. So if the gas exchange takes place, the carbon dioxide is converted into the oxygen. So from there is alveoli. So that from alveoli, so that blood, the oxygenated blood, so and also is going to enter into the heart through the pulmonary vein. So the pulmonary vein carries the oxygenated blood to the left ventricles. So from the left ventricle, it's going to left atrium, then it go to the left ventricle. From the left ventricle, it goes to the, so then it's going to the aorta. From the aorta, it's going to distribute the throughout the heart. So there we are going to the how the blood circulation is going from the lungs. That is how the oxygen is supplies from the lungs to the our heart. So that means the blood only is carries the oxygenated blood. So the blood is carries the oxygen to the tissues. So if any abnormality in the blood circulations and also any heart functions, so the oxygen supply is going to be decreased to the tissues. So if there is no oxygen supplies to the tissues, so the tissues are going, the cells and tissues are going to be damaged and also may chance to die. So it gives the serious complications. So that is the reason. So if we apply the CPR, so when a person's experience the cardiac arrest, whether due to heart failure in adults or elderly or an injury such as the near drowning or severe trauma, in the child, heart goes from the normal arrhythmic patterns called the ventricular fibrillations and eventually ceases the beat altogether. So we're having abnormality in the heart functions, especially in case of any drowning, if anybody like in the water, if anybody drowning, or if any suddenly trauma, severe trauma, or maybe if any heart damage. So may chance to get the abnormal beat is made chance to develop. So the heartbeat is going to be altered. Sometimes it's going to be very fast, or sometimes going to be slowly contracting and relaxing. So that means alter the rhythm of the heart function. So that is also called as is the ventricular fibrillations. So it's going to be, they may chance to get the fibrillation and flutter. So that means abnormal cardiac rhythms. So in these conditions, so if we give the CPR, so the CPR is going to prevent the oxygen from the circulating throughout the body and rapidly killing the cells and tissues. So if we give this cardiac CPR, that is a cardiopulmonary resuscitations, so we are going to prevent the decreasing the blood circulation to the cells and tissues, so we can prevent the tissue damage. So in essence, the cardio and pulmonary resuscitations and also serves as an artificial heartbeat and also artificial respirators. So if we give the compression over the chest, and also if we give the artificial respirations, mouth to mouth respiration, mouth to nose respirations. So these are nothing but is artificial respiration. That means artificial oxygen we are going to supply. And also if we give the pressure over the chest regions, so we are going to give the pumping action, artificial pumping. So because of the artificial pumping, the blood is going to pump to the tissues, so we can prevent the tissue damage. So the CPR may not save the victim. So even when the performed properly, so sometimes if you give properly, so after the time period, for example, if you cross the more than 10 minutes, so we are not bringing their normal functions. So, but if we give these CPR techniques within the 4 minutes of the cardiac arrest and also defibrillations, so is provided within the 10 minutes, so a person has a 40% chance of the survival. So because of these 4 minutes is a very, very crucial time. So if any patients get any collapse, like in the heart attack and also the pulmonary dysfunctions, anything like a breathing difficulty also, this 4 minutes is called as the golden period of the time. So because of how much we are going to delay before the resuscitations, so they are going to get that much of severe damage may chance to happen. So because of this decreasing the blood circulation to the tissues, so more than millions of the neurons are going to be damaged, and also the tissues are going to be damaged, the cells are going to be damaged. So in our body, trillions of the cells are there. So because of the decreasing the blood circulation within the 4 minutes, so many millions of the cells are going to be get the damage. So each minute is going to get the so much of the damage is there. So the recovery is may chance to delay if it cross the more than 4 minutes. If it is of 10 minutes above, so the we are difficult to get bring them into the normal the health functions. That means the cell functions. So they may last the so many the limbs function as well as sometimes the patient may chance to die. So that is the importance of the CPR. So if we do the CPR within the 4 minutes, so we are going to survive, we are going to improve their functions, as well as we are going to bring back into the normal breathing pattern and also cardiac functions. So for these reasons, so what we have to do, how to perform the CPR. So for this reason, sometimes we need some equipments. So these are going to be the equipments of the hard flat surface of the to why we have to get the hard flat surface means while giving the chest compressions, the patient should be comfortable unless the flat surface should be hard. If it is the movable, is not like a stable. So whatever we give the like a compression, the patient won't get much compression on the heart, so it won't get perfect CPR. So that's the reasons the artificial the flat surface is required. So normally in the emergency, like in the like in the in the in an ambulance or in the emergency ward. So this is the hard surface is going to be the flat hard surfaces. So this equipment is going to be used in case of the CPR like a management. While performing CPR, so this is the hard flat surface is important to maintain the body in the stable positions. And also no additional equipment is necessary, but in the hospital setting, emergency cart with the defibrillators and also cardiac meter should be brought to the bedside, and also crash cart contains. So many equipments. If you see the airway equipment, suction equipments, intravenous equipment, laboratory tubings and syringes, the pre-packed the medications for the advanced life support. So in this box and also in this cart, so many things. If you see the artificial ventilations, so we have to give the oxygen supplies to the oxygen cylinders. So sometimes the patient is maybe having some serious injury, may chance to get the vomiting and also bleeding from the mouth, from the nose. So sometimes we cannot give the artificial ventilation through the mouth to mouth. So in those conditions, we are going to give the some ambu bags and we have to use some masks. So some saline equipments, IV equipments, the kits are we have to use, and also some equipments, especially for the advanced life support. So these are the two types of the life supports. One is the basic life support and also advanced life support. So we are going to discuss the phases of the life support, how we are going to do. So these are the equipments for the, especially for the CPR. So this is a cardiopulmonary resuscitation equipments. So these are the some suction equipments. So we have to, if any suction is there, we have to do the suction equipments, and also intravenous equipments that IV, and also some syringes also we have to use, gloves and masks. So, and also in case of in the emergency, if we are not stabilized with the basic life support, we have to do the advanced life support with some medications as well as the defibrillators. That is a DC shock, is nothing but is the direct current, is a electric shock over the cardiac. So it will improve the cardiac functions. If the cardiac, if any conduction is lost, in those conditions, we have to do this DC shock. So if you see the phases of the cardiopulmonary resuscitations, so what are the phases? So phase 1 and phase 2 and phase 3 are there. So this cardiopulmonary resuscitation, 3 phases. So this, the first phase is going to be the basic life support phase. So in the basic life support phase is going to be, we have to concentrate on the 3 things. So that is the CAB, that is a cap. Previously, we used to term as the ABC, that is the airway, breathing, circulations. But according to the new guidelines, now changed, that is a CAB. First, we have to concentrate on the circulations. If anybody get any injury or loss of heavy bleeding, so because of the heavy bleeding, they may chance to get the hypovolemic shock and also may chance to get the cardiac arrest. So that's the reasons. First, we have to check the like a circulation. Is there any heavy bleeding or any damage in the arteries? So are any open injuries? First, we have to check about the circulations. If it is the heavy blood loss due to artery, like a cut, or maybe is because of the open injuries or any pelvic injuries or the femur fracture. In those conditions, we have to concentrate on the circulation, try to stop the bleeding. with the application of some bandages. Last time we discussed in the last class, we discussed about the how to control the bleeding. In the last class, we discussed the same procedures we have to do to improve the normal functions. That means to prevent the blood loss. And also airway also, if the patient is in the airway, how is it the breathing patterns? So how is it clear or not? So we have to check. If it is not there, we can provide the artificial airways. And also we have to give the breathings. So we are going to discuss how we are going to do the circulations, airway and breathings. So coming to the phase 2, so phase 2, if it is not recovered with the basic life support, so we have to do the artificial, we have to do the advanced life support. So in the advanced life support, along with the basic life support, that means we have to do all the airway and also the circulation, airway and breathing. Along with the basic life support, we have to give the drugs administrations. So some important drugs during the advanced life support, such as the atropine injections. So these are going to be improve the cardiac functions. Along with this one is the ECG, and also we have to do the defibrillations. So how the, and also next one is we are concentrating on invasive airway procedures. So sometimes these basic airway procedures are, we are, if we not ambu bag and this mask is not suitable, so sometimes have to do the, so ventilatory, that's invasive airway procedures. So we are going to put the tubes inside the mouth. So with the endotracheal tube, and also sometimes may chance to give the ventilators have to provide in the advanced life support, advanced cardiac life support. And also in case of the phase 3, in the phase 3, in the that is going to be the prolonged life support. So prolonged life support means after completing the recovery, how we are going to maintain their life. That means the throughout the life. So how we are, that is the prolonged life support. The post resuscitation care. So after the stabilization of the patient's heart rate and also breathing rate and also oxygenations. So we have to maintain that means we have to improve their quality of the life after the patient get stabilized. So these are the 3 phases of the cardiopulmonary resuscitations. So here we are going to discuss about all the phases, how we are going to do. Actually, this is a very vast topic. So we can, as soon as maybe in this class, we are going to try the finish it, what are the important aspects of the CPR. So if you see this life support, just now we discussed these life supports are going to be 2 types of the life supports. So first thing is the basic life support and also advanced life support. So the basic life support is going to be without using of any special equipments. So if you see here, so in the basic life support, we are not going to use any equipment. So we are going to do the only basic steps are going to follow. We are going to give the compressions, and also we are going to give the artificial respirations. So mouth to mouth respirations and also mouth to nose respirations. We are going to give the chest compressions and also the breaths. So 2 breaths and also 30 compressions we have to give. So that is only the basic life support. So in the next one is the advanced life support. So in this advanced life support is going to, we are going to use the special equipments, especially the airway equipments, endotracheal tube, and also defibrillators. So these things we are going to use in case of the advanced life support. So in which conditions we are going to use the basic life support and which conditions we are going to use the advanced life support. So that is depends upon the patient recovery or patient response according to the basic life support. If the basic life support is not working, the patient is not responding properly, we can go to the advanced life support. So coming to the chain of the survival, so we have to follow, just now we discussed, CPR is nothing but is the cyclic manner. That means a series of the activities we have to do it to provide the sufficient oxygenation to the patient to prevent the cardiac arrest as well as the pulmonary complications. So if we see the chain of the survival, so how to prevent the serious complications. If any patient collapse, first thing is we have to early recognizations and call for the help. So if any patient collapse, so we have to know what is the importance of the CPR and also who need the CPR. And also if any collapse, is the patient required the CPR or not. So easily, first we have to work if anybody having the healthcare providers, that means if any healthcare providers are available near to the patients, so they have to recognize first. So are they need the a CPR or not? So what they got the problem. So that means are they having the cardiac arrest or maybe breathing complications or sometimes is a combinations. So if they recognize immediately, so have to call for the help. So they have to call for the help. So these things are going to be this early recognition, call for the help. Main purpose is to prevent the cardiac arrest. So if you're not giving proper time, if you are not recognized properly, or they require the CPR or not, so they may chance to get the cardiac arrest. So that's the reasons. So have to start the early CPR. So why have to start the early CPR? So if you recognize the patient required the need is a CPR, immediately start the CPR. Otherwise, if you delay in the CPR or more than like a 4 minutes, each second is going to be so many millions of the cells are going to be die. So it may give the severe complications. So that's that is the important period. So we cannot we bring back them to normal positions because of the cells this dies means, so they may chance to get the severe complication. So that is the reason that period is called as the crucial period, also called as golden period of the stroke patients or in the heart attack patients. And also, if you identify so how to start the CPR as soon as possible. So if the patient is not getting recovery with the basic support and basic life support, that is such as the basics like a CPR, so then immediately start the defibrillations. So this defibrillation is mainly in case of if the patient having any conduction delay. So especially this conduction is supplied by in the heart. If you see the conduction of the conductive system of the heart, especially the SA node is the sinoatrial node, and also AV node is atrioventricular node. So these two nodes are going to give the electrical signals to the throughout the heart muscles. So if any detection abnormality in the SA node and also AV node, so if we start in the early defibrillations, so we are going to give the stimulus to the heart and also may chance to get the conductions. So we can prevent and also restart the heart functions with the electric shock, also called as DC shock, also called as the defibrillations. After that, so if the patient get recovery, so if the patient shipped to the hospital emergency, so with the help of the healthcare providers as well as the emergency technicians, so then we can give the post resuscitation care. This is also very important. So the importance of the post resuscitation care is to restore a quality of the life. So after survival of the patients, we have to provide the quality of the life to the patients. So then only we are going to give the best quality. That means we are going to give the improve the quality of the life after the resuscitations. So first thing is, so while giving the resuscitations, so we have to check for the safety is important. So if any patient collapse, for example, if any a road traffic accidents or maybe any train accident or anything also, first check for the safety of the emergency healthcare providers as well as the doctors so who are available, and also patient safety also important. So because of if any surrounding thing is dangerous, so first we are may chance to get the damage to the therapist, that means the physicians as well as the patient also. So we have to check surroundings if any danger is there or not. So that is the important. Look for the dangers, and also if any danger is there, first we have to clear. We should not enter there. Otherwise, you may chance to get the damage, you may chance to get the accident, so it may give the further complications. So these things we have to check for the safety as well as the patient safety as well as the physicians or healthcare provider safety is important. So movement of the trauma victim, so only when the absolute necessary. So if the patient is there, so if it is necessary, if any immediate any serious complications, then only we have to shift the patient. Otherwise, we should not shift the patient. So, and also one more thing is, if we are shifting the patients, we have to check for any instability in the patients. Is there any head injury or any cervical spine injury or any a spinal cord injury? We have to check. Otherwise, because of the improper handling techniques, they may chance to get the further complications, especially in the cervical regions or in the thoracic regions, if any spinal cord injury. So if we improperly handle the patients, so it may twist the head or it may turn towards one side if it's not proper positions. If is there in case of the fracture of the cervical vertebrae, it may use the compression to the spinal cord. So because of the compression of the spinal cord, they may chance to get the loss of functions, loss of motor functions and sensory functions. It may leads to the paralysis. So depends upon the involvement of the structures, they may chance to get the paralysis. If it is cervical regions, they may chance to get the quadriplegia. All four limbs are going to be loss of muscle, like muscle functions and sensory functions in the upper limbs, and also body and also lower limbs. In case of the lumbar region, if the thoracic region involvement, so it's going to get the, so below the injury level, loss of function may happen. So in the thoracic level means in the thorax levels, if you injury in thoracic, so below the thoracic, the loss of function. So they're going to get the loss, the normal function in the upper limbs and also upper body. But the injury side, below the injury side, they're going to get the loss of functions. So the safety is important. And also next one is we have to recognize early recognizations. So early recognition is, are they need do they need the having like a CPR requirement or not? So we have to check. So first, this purpose we have to do the small assessment, simple assessment. So this assessment is the crucial importance, it including the unresponsiveness. So we have to go to the patients, check for the patient response. So I have to struck the shoulders. So if they struck the shoulders, if the patient is not responding, so we have to shout. That means, are you okay? Are you okay? We have to tap the shoulders, have to tap the shoulders or tap the shoulders. Hello, are you okay? Are you okay? Or something. Mr. Some is a X. Mr. X, are you okay? Are you okay? So if the patient is responding, so that means if he's open the eyes, or if they're trying to like orient, if they communicate means, is a no problem. That means the patient is communicating. After that, we have to check any other complications. But if in case of the patient is not consciousness, and also if the non-responsiveness, so we have to check the patient immediately. And also if the patient responds, leave the patient client and also call for the help. And return to the quick as possible to repeat the like the persons. We have to give the, I'll also ask them to breathe in and breathe out. So we have to check the response. So this is, we have to see the response. So according to their response, we have to respond according to their feedback. So if the patient is not if the respond, so we have to keep the patient there. So we have to alert the alarm. So we have to come outside and also call for the help. So or otherwise, if what are the emergency, like a phone calls, so maybe we can call to the emergency, to the ambulance, or what is the emergency department. So at that time, then we can get the help from the emergency department nearby, the ambulance which are available. So they're going to come and also going to help to survive the patients who have got the complications. So here we have to check if the patient, if the rescuer is one person, if the rescuer is two persons, so depends upon the one person and two persons, the treatment technique is going to be different. So if the one person, so only have to, if the one person first activate the emergency medical services. So first we have to call to the medical services, or maybe in case of some countries are going to be 911 in USA, or maybe in India is a 902, and also 102 and 108, or maybe in Malaysia is 100, or maybe in China is a 120, that 120. So this depends upon the country to country. The phone, like a toll-free number, or maybe is the direct access is there to emergency department. So if the one person is there, so we have to activate the emergency medical systems. If the two persons are there, one person has to activate the emergency system. So immediately start the CPR. So if the two persons are there. So if the one person, so activate the EMS, emergency medical services, then return to the victim and start the CPR. And also as soon as possible, if the patient is not cooperate, then we can, like not responding, so then start the defibrillation with the shock. So in case of the two persons, so first start with the CPR, then activate the EMS, that we have to start the emergency medical services. So then we can do the defibrillations. So this depends upon the person's availability. The two person, the treatments we can start immediately. If the one person, first I have to seek for the help. So if after patient response, if the patient is responding or not, so first thing is we have to call the patient, is he okay, or are you okay or not? So what is the problem? So then we have to check. Then we have to check for the breathing patterns. So how is the breathing patterns? So look for the breathing. Is the normal breathing patterns, or abnormal breathing patterns, or absence of the breathing? So if the breathing is, so we have to look for the breathing. So if no breathing or no normal breathing, so if no normal breathing is called as the gasping. So sometimes they are going to breathe like abnormal breathing. Suddenly take long breath, or maybe breathe many times, or abnormal breathings. So this type of breathing patterns have to identify. So who are having abnormal breathing patterns. So we have to give our now like a artificial breathings. So then we have to start the like a pulse checking. So what is the pulse? So after that we have to check for the response, look for the danger. So if the danger is there or not, if the danger is there, we have to clear the danger. So then we have to go to the patients. So we have to look for the we have to call for the response. So we have to call the patients, look for the response. If the patient is respond, so it depends upon the patient response, we have to start our CPR. So then we have to do the pulse checking also. If no pulse felt within the 10 seconds, so we have to do then we can shift the patient as soon as possible. We have to start the shift the patient to the support area with the proper positions. So we have to use the hard flat surface. So we have to shift the patient to the hard flat surface. Then we can check for the pulse at the carotid levels. So where to check the carotid pulse? So if you see here, so this is the windpipe, the trachea, and also this is we have to do the 1 to 1.5 centimeters lateral to the midline of the neck. So upper level of the thyroid cartilage. So this is the thyroid cartilage. So around the 1 centimeter, 1 centimeters. So you can see here. So this is a is oblique muscle is called as the sternocleidomastoid muscle. So this muscle is so in between the sternocleidomastoid muscle and the thyroid cartilage. So in between here is a triangle. So here we are going to palpate the carotid artery pulsations. So maybe felt with the fingertips or thumbs, which are used to push posteriorly. So slowly we can press it. So we are going to palpate in between the sternocleidomastoid muscles, and also next in between the windpipe or the thyroid, the in between the thyroid cartilage and also sternocleidomastoid muscles. So this is examination, and also how to do the pulse checkings. So after that, so we have to do the CPR sequence. So these are going to be the cap, that is the compressions, airway, and breathing. So these are the important things to provide and to restore the normal function of the heart and also lungs. So before going to this sequence, first we have to know what is the position of the rescuer. So that means who are the healthcare providers are available. So how to do where to give the positioning properly. If, for example, if you see here, on the frim surface, we have to maintain the patient's position on the frim surface, either there's a backboard or on the floor. We can give on the floor, or if it's not properly available, so we can give the backboard, that is the hard flat surface. The rescuer should be very close to the patients, kneel beside the victim, chest or the stand beside the bed. So we have to stand the stands, or if it is on the ground, so have to do the kneeling positions. So heels of the one hand also on the intermammary lines. So that means the one hand is near to the in the sternal regions, which is the lower half of the sternum. So that means if you see the lower half of the sternums, place the heel of the hands. So we have to keep interlocking the fingers in these positions. So these both hands are going to be, so depends upon the dominations. If you are a right hand dominant, so you can give the over the it's the lower end of the sternum, you have to give your right hand. So it depends upon the dominance of the hands. You can use either right hand or left hand, the lower. So heel of the other hand and the top of the fist first, so that the hands are the overlapped and parallel. So and also lock the elbows. So in this the kneeling positions, so we have depends upon the heel. So we have to keep here. So first put the right hands and also interput this ones, and also we have to place it on the lower chest. So have to apply the pressure on the lower chest. So while giving this compressions, the patient should be in the straight positions, and also the healthcare providers who are giving the CPR, so how to maintain the position properly. So that means they have to lock the also shoulders and also elbows. So because of the locking the shoulders and elbows, our pressure is going to be distributed equally. Otherwise, if you bend the elbows, so the pressure won't reach to the heart. So that is the main a position of the rescuer. So coming to the next one is the chest compressions. So these chest compressions, have to give, so this one is going to be, we have to give the chest compression over the cardiac, also called as heart regions. So these are regions it is called as the cardiac massage. So the human brain cannot survive more than the 3 minutes with a lack of circulations. So chest compression must be started immediately for any patients with the absent central pulsations. So if any absence of the central pulsations, such as the carotid pulses, so in those conditions, immediately, as soon as possible, we have to do the is external cardiac massage, are also called as we have to give the compression over the heart. So within the less than 3 minutes, so we can give the, that means we can bring back them into the normal functions. Or otherwise, after crossing the 3 minutes, in the 4 minutes, so each second are going to be so many millions of the cells are going to be die. So it may give the serious complications. So that is the reasons. So this period is called as the golden period. So how to do the chest compression? So the patient must be placed on the hard surface or either wooden board. So the patient should be comfortable. Comfortable means, so we always should be in the straight positions. And also next one is we have to give the proper positioning to the rescuers who are the one person, if the two persons, one should be over the, like a head, the behind the head, and also one should be the beside the body. So that means the palm of one hand is placed on the concavity of the lower half of the sternum, the two fingers above the xiphoid process. So this is going to be a xiphoid process. So this is going to be, we are going to be apply here the, so the force is going to be applied the xiphoid area. That is nothing but the lower sternum. So here is going to be before the, like a fingers above the xiphoid process. So because of avoid the xiphisternal junctions, they may chance to get the fracture and injury. So if we go a little bit down there, so down here, so xiphoid process is there. The xiphoid process is the, like a projection in the projection at the ending of the sternum. So if we pressure over the xiphisternum, so may chance to get the fracture. So that's we have to give into the lower sternum, we have to give the pressures. So next one is the other hand is placed over the hand on the sternum. The shoulder should be positioned directly over the hands with the elbows locked straight and also arm extended. Use the upper body weights to compress. So our body should more put the weight on the chest of the patients. The sternum must be compressed or depressed at least 5 centimeters. So if we give the interlock positions, if you press one time, we have to stabilize, give these positions. So with each position, that means each compressions, at least the 5 centimeters, it should go inside. So the depression should be at least 5 centimeters in the adults, 2 to 4 centimeters in the children's, and also 2 to 4 centimeters in children, and 1 to 2 centimeters in the infants. So here the pressure and also compression is going to be different for the adult and also children, and we are going to do in the infants are going to be different. For the adults, we are going to use the heel of the hands, with the both hands are going to be used for the compressions. For the children, we are going to be the single hand, and also we are going to use the heel of the hands. So, and also for the children, for the infants, we are going to use with the both two fingers. So we are going to give the compression with the two fingers. So this is depends upon the age group of the patient. So we should give the compression force according to the age group. So if we see here, so xiphoid process, so here is the xiphoid process, this is here. So these are two fingers above the xiphoid process. So we have to check the two fingers. So place the xiphoid process. Above the xiphoid process, we have to keep our hands, or the both hands, depends upon your dominant hand, it should be is downs. So then only we can give our pressure compression force over the heart. So these are going to be improve the circulations and also improve the oxygen levels. So these compressions must be at least 100 to 120 per minute. So that means at least the 30 compressions for the is going to be is going to be within 30 seconds. At least we have to give the 60 compressions. So that means that per minute, at least minimum 50 to in 1 minute, at least 1 to 100 to 120 times we have to give the compressions. So the ratio of the CPR should be the single rescuer. It should be gives the 30 compressions and also 2 breaths. So 30 times have to give the compressions with the hands. So after 30 compressions, so we have to give the breathe through the mouth to mouth or is the mouth to nose. So depends upon the requirement. So if the presence of the 2 rescuers, chest compression must not be interrupted for the ventilations. So that means if the 2 persons are there, one has to give the compression, another has to give the is one have to give the breathing. So we should not give the time in between that the two patients are available. If the single rescuer is there, so one time he has to give the 30 compression, then he have to give the 2 breaths. So here have to give the 30 compression over the sternum. So after that, the one person's so have to give the 2 breaths. So the 2 breaths also have to give the special position, head tilting positions. So then only we are going to give is a complete like the breathing properly into the lungs. Otherwise, if the patient in the neutral positions, whatever you do the mouth to mouth respiration, mouth to nose respirations, the air cannot enter into the windpipe and also cannot enter into the lungs. So that is the important feature while giving the breath mouth to mouth respirations. So this is very, very important while giving the CPRs, 30 compressions and also 2 breaths. So for the children, especially we are going to give so you can see here, the children, we are going to give the thumbs, and also we are going to, for the infants, we are going to give the, like 2 fingers we are going to use. So this one is going to, thumbs are going to use in the children, and also fingers are going to be used in the infant. So here we have to give the 30 compressions, then we are going to give the 2 breaths. So the chest compression must be continued for the 2 minutes before the reassessment of the cardiac rhythm. So have to continue the 2 minutes. So each compression, each like a set, at least we have to give the 30 compressions and also 2 breaths. So we have to continue. So that means at least in 1 minute, 120 times we have to give. That means 4 cycles we have to give in the 1 minute. So in the 2 minutes, we have to give the 8 cycles have to give. So in this one, is 2 minutes equivalent to is 5 cycles. So that means is going to be, normally we are going to give the 100 and 120. So it will be divided into the 5 cycles. So these 2 minutes, 1 minute at least we have to give the 2.5 like a cycles. Then we have to, if we do if we fast, depends upon the healthcare providers, depends upon the CPR providers. So it may be vary. Some people are going to be very slow. So the cycles are going to be delayed. But normal, at least we have to finish at least 5 cycles in the 2 minutes. So this is the very important things. Then only after that, we have to reassess up 2 minutes. So according to the reassessment, we have to continue the further cycles or not. So depends upon the patient response. So, and also we have two golden rules, also ensure high quality of chest compressions. So that is the rate, depth, and recoil. These are the 3 important. That is the reasons the cycle. Normally, if you do the normal compression forces, compressions are 100 to 120 per minute. So, but if you do the 100 is at 120, so who can do perfectly? That means they can do 120. That means the 4 cycles in 1 minute. In the 2 minutes, 8 cycles are going to finish, but depends upon the person to person vary. So that's why these are also going to be depends upon the rate, how much of the compression rate, is it the 100 or is it 120, or depends upon sometimes may less also. Depth also, how much depth is going. Normally in the adults, it should go compression minimum 5 centimeters differentiations. So, and also recoil, if the compress and also it should be recoil. So I have to give the compression and recoil. So these things only will give the perfect, like I see, we are going to give improve the like a heart rate and also the heart function and also the breathing functions. So these things we have to consider while giving the CPR. Should be the rate should be proper. That means how much time, how many times we are giving. The depth is going, how much depth is going to depressions, and also how much the recoiling. The plan action before interrupting the CPR. So before stopping the CPR, so we have to plan. What is the next plan? Is there any emergency, or is there any, the patient is recovered, or have to ship the hospital? So everything should be planned before stopping the CPR. Minimize interruption of the chest compressions. So we have to minimize, if the 2 persons are there, minimize the chest compressions. If it is not, patient is not getting recovery, early defibrillation of the shock wave rhythms. So you have to plan and also start the defibrillations or with the DC shock. So these are the very important things while giving the CPR. And in between, we have to check for after 2 minutes, so we have to reassess the patients about the blood pressures. So the blood pressure should be how much the systolic pressure, how much the diastolic pressures we have to check. So if any improvement in the systolic pressure or diastolic pressures, and also cardiac output also have to check all these things. So while doing the CPR. So some problems may arise during the giving the CPR or maybe giving the compressions may chance to get the other complications. Who met with an accident or road traffic accidents or because of the high violence or maybe may chance to get the some fractures, especially the rib fractures, and also fracture of the sternum, and may chance to get the rib separations, pneumothorax. That means the air is going to may enter into the lungs, and also hemothorax, blood may enter into the lungs. Lung contusions may chance to get the damage and also may chance to get the blood clot. Liver lacerations, liver damage, fat embolisms, fat is going to be distributed in the bloodstream. And also the patient may chance to get the HIV. So the therapist, if the physicians are maybe who are the healthcare providers are there, so they may chance to get with the HIV and also your hepatitis or any infections. So these things we have to consider while giving the like a CPR. So in case of rib fractures, so we have to handle and also we have to manage according to the problems. So in those conditions, the rib fracture also have to do the CPRs. Rib fracture also because we have to manage and also give the CPR. Otherwise, the patient may chance to die. If the rib fracture means they may chance to get the severe pain, but no choice. So no choice, other choice. So but we have to continue. But with the precautionary measures, we have to like place some paddings and also to avoid the further piercing of the ribs or maybe sternum fractures. So these things also the special considerations we have to think and also we have to do the CPRs. And also in case of the airway, so how to check for the airway. So in case of the loss of consciousness, the results in the airway obstruction. So due to loss of the tone in the muscles of the airway and falling back on the tongue. So we have to check the tongue is the fall backside. So we have to check the like a airway. So any obstructions. So we have to tilt the head and also put the fingers and check for the any obstruction because of the any foreign body materials or maybe because of the any tongue is shifted or twisted or either tilted backside. So we have to check for the any abnormalities. And also we have to check here. So in this one, we have to lift the head lift and also chin lift positions. One's hand is placed on the forehead and also the others on the chins, head lifted upwards to cause the anterior displacement of the tongue. So here is going to be, so in these positions, the head is going to be in the neutral position, the tongue is going to be blocked. So if we lift the head and also we are going to get the positions, that means we are going to clear the airways. So if you see here, the airway is going to be open in the head tilted position. So and also if it is sometimes, so if you are giving the mouth to mouth respirations, so we have to give the head tilt and also jaw thrust. So this position is going to give the more clearance to the airways and also help to produce like a help to improve the airways to the patients. So in case of any obstructions, any foreign body materials, or if any swallowing, so we have to put into the mouth and also check for the any obstructions. So then in case we can think, so we have to remove the foreign body materials. So here is going to be a sweep out the foreign body in the mouth by the index fingers in unconscious patients only. So this is not advised in a conscious patients or as a convulsing patients. So in conscious patients, what will happen if you put sometimes they may swallow because of the patient is conscious, or in the convulsing patients who already got the seizures or in the who already like fits. So sometimes they may chance to get the other problems. So we should not do it in the conscious patients. And also in this case of the any abnormality, the swallowing, if the patient any obstructions, so we have to do the Heimlich manoeuvres. So this one is going to be, we have to give the abdominal thrust. So if the patient is conscious, so our the foreign body cannot be removed by the finger swab. So we have to, it is done while the patient is standing up or is lying down. So this is the supradiaphragmatic, the subdiaphragmatic abdominal thrust. So this is going to be give the abdominal thrust. So if abdominal thrust, so whatever the obstructing material is going to come outside. So expelling the blast of the air from the lungs, so the displaces the foreign body. So so this one is we have to do the either doing the lying positions, or in case of the patient is the standing position also we have to overlap in between our hands, and also we have to give the abdominal thrust. So give the abdominal thrust. So whatever the depends upon the force, so this any foreign materials is going to come outside. But in case of infants, we are going to give some of the prone lying positions with the hands. So they can give the blow on the back, and the chest thrust is going to give the chest thrust, or maybe is a blowing on the the backside, so the obstruction material is going to come outside. So these are the two, the maneuver, these maneuvers are going to be, Heimlich maneuvers are going to be helpful to remove the foreign material from the obstructed trachea or lungs. And also coming to the breathing also, breathing is also very, very important. So if it's breathing is not possible, if the patient is abnormal breathing, so we have to give the mouth-to-mouth respirations. So rescue breathing can be mouth-to-mouth breathings or mouth-to-nose breathing if the mouth is seriously injured or can't be opened. So if the sometimes, so depends upon the patient conditions, if the patient unable to breathe, so we have to give the mouth-to artificial breathing through the mouth-to-mouth as well as mouth-to-nose breathings. So with the airway, so here we have to do use the head tilt and chin lift maneuvers. So just now we discuss here, so they have to do the head lift maneuver and also jaw thrust maneuvers. So these are going to give the like a mouth room. So here we have to pinch the nostrils and also shut for a mouth to open breathing and also cover the person's mouth with your and also then we have to use the making a seal. So we have to use the mouth to mouth. So close the nose and head lift. So we have to close the mouth with our mouth. So then give the blowing into the mouth. So these are going to be improving the like oxygenation to the patients. So the mouth to mouth respiration, the patient always close to the head and also these chin lift maneuvers. So it has to close the nostrils, both nostrils, have to give the mouth-to-mouth respirations. With our mouth, the patient mouth should be closed, also sealed properly. Then we have to give the breathing properly. So this is called as the mouth-to-mouth breathing. So and also is the mouth-to-nose breathing. So mouth-to-nose breathing, in these conditions, we have to do the chin lift condition and also positions and also close the mouth with the chin lift and also stabilize the mouth seals and also then we have to start the breathing through the nose. So this mouth to mouth and also nose is commonly used in the children's and also infants. So these are the special techniques, artificial breathing techniques to improve the breathing in oxygenation in the who got the cardiac arrest and also breathing complications. And also another important techniques in the prone lying position also, we have to do the CPR in case of some immediate reactions. If the patient is not cooperate, if the patient is not suitable doing in the supine lying positions, so have to do the prone lying positions, especially in conditions of the any brain injury. So normally, according to the American Heart Associations, we have to do the CPR always do in the supine lying positions. So in those conditions, if, for example, it's not possible, especially in case of any brain surgeries, so have to do the in the prone lying positions. So in the prone lying position, the head turned towards one side, and also we have to give the same like compression. We have to give how we are giving the supine lying positions, how to give in the prone lying positions. But the only difference in the prone lying positions, but these things is not suitable in the public areas. If the patient collapse in the public areas, we should not do in the prone lying positions. We try to give in the supine lying positions to prevent the further complications. But these positions also consider we have to give in case of the in case of who are undergone for the brain surgeries. So here we have to do the patient in the intubated or is we have to keep in the prone lying positions. Same thing, we are going to give the support to the sternal support. We have if the patient is not support properly, so we have to put the any flat hard surface below the sternum. So then we have to give the same, we have to how we are giving the supine lying positions. So how to give the compression over exactly in the T7 position, that is thoracic vertebra. At the T7, we have to give the compression. So in between the two scapulas, how to give the prone lying positions CPR. But it's not suitable to the all the times, but in the emergency condition who are gone for the underlying for the like a surgical procedures in the for the brain surgeries. And also another things is the some modifications in the especially for the we have to give sometimes in the case of pregnancy also. In the pregnancy also we have to give. So these things are the sometimes the patient in the supine lying positions, so we unable to give the like a cardiac resuscitation improperly. So that's the reasons. So we have to change the positions in the supine lying position to the side slightly tilted the 15 to 30 degrees. So if the patient, like a pregnant patient, if they're supine lying positions, so may chance to get the compression over the inferior vena cava. So it may lead to the other complications. So if you want to give the resuscitation in the pregnancy conditions, we have to tilt the patients 15 to 13 degrees. So then we can give the resuscitations. So here we have to do the same thing. We have to follow the same. We have to check for the response from the patients, and any dangers are there, we have to check. So, and also we have to do the lateral positions, that is 15 to 30 degrees. And also here, the rescuer and the knees are using the wedge. So we have to very close to the patient, and also displace the uterus manually, gently, and left lateral while lying supine positions. So we have to place the patient positions in the lateral positions. So then we have to give the good ventilations with the bag valves or also masks. So if it is any abnormality in the fluid, like disturbances, and also if the IV fluid bolus to correct. So we have, in case of, we have to correct the fluids, if anybody having the dehydrations, if any fluid loss, so we have to replace the fluids immediately. So, and also have to give the oxygenations. So then we have to give the same, how we apply to the resuscitations, compression to the other people's. So we have to give the compressions, that is 30 compressions and 2 breaths. So these things are we have to provide properly, and then only we can give the full support to the patients. If then it depends upon the patient response, so we have to ship the patient as soon as possible to the hospital, and also give the emergency treatment. If the patient recover, so we can give the post resuscitation care after the recovery. So in these conditions, in the pregnancy, so here also going to be, in case of is a hysterectomy also they may chance to get, in case of if they're having any abnormality during the pregnancy time. And while giving the resuscitations, we have to think about the cervical spine stabilizations. Otherwise, they may chance to get the damage to the cervical spine. It may give the paralysis. So these things we have to consider while giving the CPR. So then we can we can prevent the serious complications. Here, main thing is, if you are the healthcare providers or the normal person also, as soon as possible, we have to respond according to the patient conditions. Then only we can give the a survival rate to the patients. Otherwise, if you are not a trained professional, if you are a normal professional, so you have to respond according to the patient situations. If you think that, if for example, if you are, I'm not a healthcare professional, I don't know how to do the compressions, means the patients may chance to get the serious complications. So you have to create the awareness about the CPR. If everybody do the CPR, as soon as possible, we can prevent the serious complications. So that is about the CPR, basic CPR, that is a cardiopulmonary resuscitation. Actually, this is so much of training is required. So who already interested, so they can go for the special trainings in the CPR. And also, if you completed your training, your certifications, you are eligible to do the trainings in the public as well as everywhere. You can get the eligibility. So this is a very vast subject. Maybe we can continue this subject in the next further classes. So hope you understand this about the CPR, how to do the CPRs, and also what are the precautionary measures, in which conditions we have to do it. So you hope you understand. So if you have further informations, we will discuss in the next class. Thank you very much. If you have any doubts, you can send me a message. I can clarify your doubts.